You have sudden cardiac arrest in the city of Mesa through all the new innovations that we've done, through the new technology that's come out, through MICR, through dispatch-assisted CPR, and through our community outreach programs to teach bystander CPR. You have about a 57% chance of surviving that event, which is one of the highest save rates in the country. And because of that number, we're really being looked at across the country and internationally. During this EMS week, what I would like to do is to have everybody sign up for a CPR course, because you guys are the key. You guys have to be able to identify when somebody is in sudden cardiac arrest. You need to know what to do, and you need to know the steps of CPR to be able to save that person, because without you, as fast as we can get there in the fire truck, they have a very, very slim chance of getting there without your help. What we're using is a method called minimally interrupted cardiac resuscitation, and we use the acronym MICR because we don't like to say that every single time. It is a method of resuscitation. We utilize chest compressions only, so we don't breathe in their mouth like the American Heart Association does, 30 to 2. So you would start your chest compressions, then you would do a head tilt chin lift and blow in their mouth twice, and then you would do 30 compressions and 2 breaths. Well, what we do is we just do continuous chest compressions. And what we have found, and what some doctors down at the University of Arizona down in Tucson found, was with compressions, it takes a certain amount to get your blood pressure up to the right level where your brain is getting the oxygen and the blood that it needs, and your heart is getting the oxygen and blood that it needs. When we stop to give the breaths, that blood pressure goes down to a point where it's not perfusing the brain, it's not perfusing the heart anymore. So what we do is we bring that level up and we keep it there. Some people say, well, don't we need to breathe? We need to breathe when we're awake. A person who drops because of sudden cardiac arrest, the last thing they do is they go, and they drop. So they just have a full breath, and that breath can last them about 8 to 10 minutes. They have enough crystallized oxygen in their blood to be able to provide the oxygen circulation. We also aren't sure, but we feel that with good hard compressions and at a rate of 100, at least 100 a minute, and 2 to 2.5 inches, that there's a bellows effect. So if we push in, when we let the chest come out, we think that they get it kind of a little bit of, not as good as a breath that they would, but a little spontaneous breath.